So now that you know the basic anatomy of an exoskeleton, it is time to talk about how it fits the pilot. Because we all know that one size fits all is truly a lie. In this video, you will learn about the importance of a well-fitted exoskeleton and how this is achieved. Your body consists of 206 bones, with even more joints to connect them. Luckily, we don't have to take them all into account when designing an exoskeleton. Let's break it down to the most important ones. If we want to walk, we need our legs. We bend and extend at our hips, knees and ankles. We'll get into these exact movements in a reading next week. An exoskeleton mechanically moves the lower body to a certain position. If we want to do this, the knees of the exoskeleton should be at exactly the same height as the pilot's. And so should be the hips and the ankles. If the joints of the pilot and the exoskeleton are not aligned, we could cause harm. Worst case scenario, we could break the pilot's leg. This means we need the exoskeleton to be the right size for the pilot. The size is determined by two main factors. The first one we just talked about. The length of the bones and the placement of the joints are crucial. This ensures the axis of rotation of the exoskeleton limbs matches those of the pilot. There are two methods to achieve this. You can design an exoskeleton that comes in multiple sizes, for example, small, medium and large. If you combine this with some sort of adjustability, it can suit most people. You could also design a customized exoskeleton that is built to precisely match the dimensions of the pilot it is intended for. This is what we have done for the last few years at Project March. The second factor determining how well the exoskeleton fits is the fixtures. Fixtures are all parts of the exoskeleton that strap the pilot into place. Most exoskeletons have roughly 4 fixtures: the shoes, at the lower leg, the upper leg, and the waist of the pilot. This way, there is always a fixture on each side of a joint. They have two main purposes: aligning the limbs and supporting the weight of the pilot. When the exoskeleton is moving, you don't want your pilot's leg to move in directions they are not supposed to. To prevent this, fixtures will guide the leg in the right direction. There are different types of fixtures. They can be categorized in 2 groups: rigid or flexible fixtures. Flexible fixtures are often straps that can be tightened around the pilot's leg or waist. They are very easy to adjust, but offer less control over the limb movements compared to rigid fixtures. Rigid fixtures come in all kinds of shapes and sizes. They can carry a lot of weight and offer more support. These rigid fixtures are often used at the legs. The exoskeleton is also strapped to the waist of the pilot. This way, hip movement can be controlled. But it can also enable the pilot to feel what is going on with their lower body. If the torso fixture extends beyond the level of injury, they can feel the direction the exoskeleton is pushing them. This makes it easier for the pilot to walk. Furthermore, it supports the torso of the pilot, which makes it easier to sit and stand upright. This is especially important for pilots with a relatively high lesion of the spinal cord. But there's also a downside to fixtures. They can prevent injuries, but can also cause them. The most common ones are wounds that are caused by the forces they apply to the body. They are called pressure ulcers, and I will tell you more about them in another video. Choosing the right frame size and fixtures can greatly impact the function and safety of the exoskeleton. To protect your pilot, always check the alignment of the joints and the support of your fixtures.